Okay, I'm going to explain left renal vein compression today, or nutcracker syndrome. These aren't new markers, they're just different colors, but hopefully you'll be able to see better. The new markers are coming in today. So, what happens with nutcracker or left renal vein compression? A couple of things, okay? So we're going to draw the aorta again. It runs down the left side of the spine into the left and right iliac arteries. And then on the other side of the spine, you've got your IVC, which is what brings blood flow back to the heart. Okay, so the kidney sits over here. There's two, but we're going to talk about the left kidney, okay, because that's the one that has the renal vein issues. Sits over here, and there's a renal vein that drains it into the IVC. The renal vein goes over the aorta in most patients. There are different variations on how the renal vein tracks, but in most patients it goes over the aorta and back to the IVC, okay? The path of the renal vein is traditionally under the superior mesenteric artery. You have your celiac trunk here. That's the first branch of the aorta in the abdomen. It goes to the splenic artery and the hepatic artery. This is where median arcuate ligament syndrome occurs. I'll talk about that one on another time. But this is the superior mesenteric artery. So it goes over the left renal vein. In another view, if you look at the superior mesenteric artery coming off the aorta, you can see the path of the renal vein is right here. If the angle of the superior mesenteric artery is narrow, then the renal vein gets compressed in that space. This is where the term nutcracker came from. Looks like a nutcracker. When that happens, the blood flow can't get back to the IVC. It gets stopped, and so you get collateral veins that form. One is the gonadal vein. It dilates, it plumps up, all the blood gets rerouted down this way. The other is lumbar veins. Blood gets rerouted up the spine, okay? So when the blood is getting diverted down the gonadal vein, then gonadal varices develop. Okay, so you get all these varices around the ovary, and you can get them in the testicle or varicocele. That's the manifestation of nutcracker that we see in male patients. So what does this cause symptomatically? We see left flank pain. We see hematuria or blood in the urine. This can be gross or microscopic, so in a UA, you can have blood for no reason. Also vague GI symptoms. And that comes along with possibly SMA syndrome and the compression of the duodenum, which occurs in the same spot, but also just irritation of the nerves that lie in this area that can cause symptoms. So that's nutcracker, left renal vein compression.